We're getting ready to do the cat blood vessels, and I'm going to walk you through it. First of all, you have to take the cat out of the two bags. Don't throw either bag away because we're going to need to re-bag him at the end. The one bag has a little bit of fluid in it. Be careful when you fold that. We do want to save the fluid because the cat needs to stay preserved for the rest of the semester. So fold up both of your bags and get them out of the way. And then lay your cat flat on a tray. And the only two instruments that you really need for this first part are your scissors and the blunt probe. Now we're going to look at how to open up the cat. You're going to use the pointy end of your scissors and you're going to insert it at the bottom of the cat's belly, about where his legs join. Some of you are going to want to use scalpels. The problem with the scalpel is you can go too deep. With the scissors, you poke the bottom end in, and then as you cut, you can pull up with the scissors. That way you're cutting the muscle and not the organs. Now you want to try to cut right along the midline, and usually there is a faint line that you can see. Try to cut straight through the center of the cat's belly, and it goes pretty easy. And I'm going to use my finger to hold it up so that I'm not cutting too deep. And it goes easy until I get right about here. Now it gets tough because I've hit the ribs. I hit the sternum. But you still have to keep cutting with your scissors. It does become hard, and I have to use two hands to do this. But you need to keep cutting all the way up through. I'm going just to the side of the sternum, cutting through the ribs. And I'm going to try to cut all the way up into the cat's neck. I'll hold it up here a bit. And cut all the way up to the cat's neck. Now, I made an incision from the bottom of the belly all the way up to his neck, and I have to make a few more so that I can fold it open. So we'll go back down to the belly, and I'm going to make a transverse cut, a cut from the center to the side, and then you're going to have a flap you can fold over, and then we'll make a cut on the other side. And now you've been able to fold the belly open. Now the next issue that we're going to come across is the diaphragm. The diaphragm, as you know, is a muscle that separates the thoracic cavity from the abdominal cavity. And I don't want that to tear, so I'm going to take my scissors and I'm going to cut along the inside edge of his rib cage, like that. As I do this, I'm separating the diaphragm. Let me point it out to you if you want to zoom in. You can see there's the diaphragm. It's this little flap of muscle. And I'm going to try to cut down on this side as well. Not sure if I'm getting in the way. Okay. Now I've cut down on both sides. The diaphragm is intact. And I am now up here at the thoracic cavity. And the next thing I have to do, you're not going to like probably, but you have to crack the rib cage. So the best thing to do is use your thumbs and get all the way up at the top where the arms are. Press your thumbs as far back as you can and crack, crack, crack. You want to crack the ribs as far back as you can, as close to the back as possible, otherwise they stick up and puncture your gloves. Now, the scissors did most of the job. The other tool, the blunt probe, can be used to clean this out a little bit. Well, I will stop and show you the organs next.